Hello, my name is Dr. Farman Ali and I am a GP family physician. Cluster headaches. Remember the word cluster. These are attacks of severe one-sided headaches. They usually come in bout or clusters and can last for weeks, months or years until the next cluster develops. Typical case is a cluster lasting between 6 and 12 weeks. They are 4 times more commonly in men than in women. The first bout or the cluster develops typically between the ages of 20 and 40 years. Other signs include it is a one-sided headache, often around the eye. They usually begin quickly and without any warning. The attacks can last between 15 minutes and 3 hours, and the pain during an attack is usually described as severe. They usually occur every day, often up to 8 times a day. Attacks often occur at night time, a couple of hours after you have gone to sleep, and it may wake you up. Redness and watering of the eye, swelling or drooping of the eyelid is common, and the constriction of the pupil in the eye. A runny or bunged up nose and sweating of the face is also common. So what causes cluster headaches? It is thought that during the attack, a part of the brain called hypothalamus releases chemicals which are called neurotransmitters, and they may stimulate the nerves in the brains to cause pain and other symptoms. Alcohol. Some people find that the headache often occurs within an hour or so of having an alcoholic drink. It is usually advised to stop alcohol completely for the duration of a cluster period. Being hot may trigger, such as exercising in a hot room or having a hot bath. Strong smelling substances such as solvents, perfumes or petrol. Almost all people with cluster headaches do not have any abnormality of their brain. However, 1 in 20 people, there is a family member who also suffers from cluster headaches. So what is the treatment for cluster headache? Sumatriptan injection given under the skin, also known as subcutaneous injection, is commonly used treatment for headache. It works within 5 to 15 minutes to ease the headache. The adult dose of this would be 6 milligrams of injection for each headache, and the maximum in 24 hours is 2 injections totaling to 12 milligrams, with a minimum gap of at least 1 hour between the 2 doses. Some people should not take sumatriptan. For example, those who are with heart problems, previous stroke or peripheral artery disease. Zolmitriptan, which comes as a nasal spray, is an alternative to sumatriptan injection for treatment of cluster headaches. 100% oxygen is given as a treatment for cluster headaches. This is an alternative that may be advised, especially if sumatriptan injections or zolmitriptan nasal spray cannot be used because of their side effects or contraindications. It often works quite well, relieves the pain within 15 minutes, but it does not work in everyone. Advantage is, when it works, that it can be used as often as necessary. The oxygen is 100%. Remember, the air that we breathe is 21% oxygen. So this is delivered through a special mask from an oxygen cylinder. Some people with cluster headaches have an oxygen cylinder and a mask kept at home. Can we prevent cluster headaches from coming in the first place? Medication called verapamil is commonly used treatment. This medication is usually used to treat heart problems, and therefore you will require an ECG or electrocardiogram before increasing to high doses. Another type of medication called lithium. This medication is more commonly used to treat bipolar disorders. And people who are on lithium requires regular blood test to measure the dose in their blood. This can be used as an effective treatment to prevent cluster headaches. Steroids, corticosteroids, they are used in short bursts of 2 to 3 weeks in decreasing amounts. Ergotamine and topiramate are also used to prevent cluster headaches. Thank you very much.